Okay, balik tayo. So we have here your PCP or your PJP. They are the same microorganisms. And these particular microorganisms are very common among clients who have your HIV. Carini, your pneumocystis jirovecii pneumonia, or your pneumocystis carini pneumonia are the same opportunistic infection. Either way, same na microorganisms yan. So, according to the doctor, yan, it was confirmed that this particular causative agent was found to be in the client's lung because they have performed your bronchoalveolar lavage examination under light microscopy. So, apart from yung ating X-ray, well, the X-ray only shows you an extent of the disease, okay, coverage of the disease in your lung fields, but it does not provide you information of the specific causative agent. So, in this case here, kailangan nating malaman kung anong specific causative agent yung nagkukos ng respiratory problems to our patient. Hence, they have confirmed that the patient has your PCP or your PJP. So, let's move on. Yan. Yan. So, on investigations, these are the results of your client's laboratory procedures. Mr. MK's admission WBC and lymphocyte studies demonstrated an increased pattern of immunodeficiency compared with earlier studies. Okay. Hemoglobin, 10.8 grams per deciliter. WBC, 7,500. Actually, your normal is 5,000 to 10,000, right? But, hindi mo makikita dito sa WBC eh. The problem with your HIV is that you might have normal WBC or maybe having an increased WBC. However, the problem there is most likely found in your lymphocytes. Okay, it's in your lymphocytes. So, BMP, that's your basic metabolic panel. It's normal findings. Segmenters, specifically your lymphocytes, you have 43, monocytes 41, eosinophils 6, and your basophils 1. Platelets is actually normal. There's no problem with your bleeding because your pinaka-concern here is actually your infectious process. Okay? That's 250,000 cubic millimeter. Next, arterial blood gas. You have 7.48. You have your PCO2 of 32. You have your PO2 of 51. You have your bicarb of your 23. So, your next job is to identify what is the reading, interpretation of your ABGs. Because again, this is very much related to your respiratory affectation. Your LDH is your lactic dehydrogenase. That's your 257 international units per liter. You have your C-reactive protein of 16.8 milligram per deciliter. Ito, put a star on this one. HIV RNA quantitation test, 234,000 copies. Sobrang dami po niyan. Hence, it actually is one of your landmarks or particular results for your HIV if you have a lot more of your quantitation test. CD4 count, again, put a star on this one. 19 millimeter mercury, cubic millimeter. 19 lang po ang ating CD4 cell count. Next, we have your Indus Fetum test smears. Okay. Apart from your bronchoalveolar lavage that was done by our patient, they have also conducted your sputum tests to really identify your causative agent, and they have seen that there is positive carinicis. Sabi ko kanina, di ba, your PJP and your PCP, carini, are actually the same microorganism. It's just that there's been a change in the nomenclature by scientists and by practitioners. Next, there's no presence of cytomegalovirus antibodies because cytomegalovirus is also another causative agent which is related to opportunistic infection. And there's also no result for your CMV antigenemia assay. So, negative po siya. That's not our problem. Our problem is this one. Positive for P-carini or PJP. So, your patient, after all of this, okay, all of this has been identified. Naku, asa na yung CT scan result natin? Walang CT scan. Space-occupying lesions lang talaga. Space-occupying lesion on this particular area. Right. Ito, that's your space-occupying lesion. If you're going to be in the clinical area, that space-occupying lesion, in some cases, would be a tumor that needs to be seen for biopsy. So, I don't think it requires your biopsy because they are associating this particular lesion as an infection process caused by your PJP for your HIV patient. Okay, so that's for your CT scan, abdominal CT scan. You also have here your telemetry strip, that's your ECG, to yung lead to ECG, which interprets sinus tachycardia, 110. Okay, so that is for your ECG. Next, let's move on. Hence, your patient was admitted in the medical unit with a diagnosis of HIV-PCP complicated by amoebic liver abscess. Yan. Liver abscess. When you have your liver abscess, it talks about infection. Kasi abscess is nana. Okay, nana siya. It's your pus. So that particular lesion that was found in your CT scan is basically your pus that has formed in your liver. That's why the patient was complaining about tenderness. And you have your oral thrush. Your oral thrush is actually your condition caused by your Candida albicans. Okay, what was answered by Ms. Bocasas earlier. Yan. Candida albicans. So, imagine guys, you are an immunocompromised HIV patient. Tapos, dala-dalawa. You have two causative agents trying to make you sicker. You have your PCP, hence you have your respiratory problem. And you also have problems in your oral thrush, Candida albicans. Okay? So, ayan po ang problema ng pasyente natin. Doble-doble. Daming problema niyaan. Hence, okay, the patient is started on intravenous because he has failed to continue on with his antiretroviral therapy. We need to catch up. The patient needs to catch up with his medication regimen for his HIV. Hence, this is an intravenous administration of those particular antiretroviral medications. You have your trimethoprim or with your sulfamethoxazole, that's your 20 milligram per kilogram, and you have your, this one, sorry, computation kasi to 100 milligram per kilogram, and, I'm sorry, 20, this is for your, dalawang medications to, no? Your trimethoprim will have, an order of 20 milligram per kilogram. And your sulfamethoxazole will have 100 milligram per kilogram per day of administration. But in the clinical area, kasi merong gamot na nakapak na lahat. If in any case, we do not have your combination drug available in the pharmacy, what the nurses do or what the doctors do is to combine your trimethoprim, okay, but computation is like this one, 20 milligram per kilogram per day, and you have your sulfamethoxazole, okay, which is 100 milligram per kilogram per day. But in most cases, meron tayong nakapack na gamot. Naka-bottle na siya na gamot for this particular medication. Plus, okay, we are going to be providing your prednisone. Your prednisone is a corticosteroid medication. We need to be giving this with caution to our client because our client is already an immunocompromised patient. Diba? What is the side effect of giving corticosteroids to immunocompromised patients, guys? What's the side effect? If you give prednisone, if you give betamethasone, if you give dexamethasone, corticosteroid to an immunocompromised patient, what will happen? Cushing's disease? Hindi Kasi, if you're just going to be giving your corticosteroid for a short time, prednisone, kasi nasa hospital lang, you don't necessarily need to, you cannot never develop Cushing's disease if it's not a long-term corticosteroid therapy. Okay? Remember, ang side effect ng corticosteroid, yes? Yes. If you have corticosteroids, they are immunosuppressants. And think about it, guys. Your client is already immunocompromised. Plus, you give your immunosuppressants. Anong ginawa mo sa immune system ng patient mo? You're adding insult to injury. Okay? That's why, if you are going to be a nurse, and you see corticosteroids to be given to our immunocompromised patient, take it with a grain of salt. You have to do extra caution there because you might be doing more damage to your client. Okay? Do or administer it with caution. Monitor the client's reaction or feedback after he or she is given your medication. Kasi, immunocompromised plus immunosuppressant is never a good scenario. Understand? Okay? You're just going to make the patient more at risk for infection. Unfortunately, your client needs your anti-inflammatory agent prednisone because there is already an existing infection. So, weighing the benefits between giving your prednisone and not giving it outweighs because your patient is suffering from inflammatory reaction, especially in the lungs. There is your inflammatory responses already in the lungs. And apart from that, you also have inflammatory response in your liver because there's infection there. And you have inflammatory response in your oral cavity because there is infection there. So, weigh the benefits, give your prednisone. Kaya ang nakalagay dito, 40 mg lang naman. And is per oral BID. Okay? So, in this case, again, you know that the client is immunocompromised, plus magbibigay ka ng immunosuppressants, kailangan mong i-monitor yung patient mo for any further signs of deteriorating condition because the patient already has an existing infection. And putting him more in that particular condition wherein he is more immunocompromised or more, immunodeficient kasi nga meron prednisone. That's a double effort on your part as a nurse. Check your patient. Okay? Next, fluconazole. Your fluconazole, pag narinig nyong conazole, guys, the suffix conazole will always be associated with your antifungal medications. Why is the patient given your fluconazole? Yes? Anyone? I mentioned already earlier. Why is your patient given fluconazole? Yes? Magtawag nga ako. Miss Favor, quiet. You've been answering my questions most of the time. Let me call Miss Credo. Hello, Miss Credo. Miss Credo, are you here? Yes. Bakit binibigyan si patient natin MK ng fluconazole? Kasi? Why? Yes? Why is the patient given your fluconazole? Nagugugol ka pa ba dyan? Yes. Miss Credo. Infection. Anong klaseng infection? Daming gamot niya, oh. Saang infection? Correct. Anong ginagamot ng fungal infection natin? Anong ginagamot ni fluconazole? Para saan? Sa lahat ng diagnosis na nandiyan. Para saan? What's your fluconazole for? Andyan na. The answer is staring at you. Yes. Look at your diagnosis. Call a friend, Miss Credo. You call a friend. Sige. Yes, Miss... Oh, Miss Dakanay daw. Hello, Miss Dakanay. Are you here? Oh, anong sagot? Diyan sa diagnosis that you could see, what is your fluconazole for? Candida albicans, that's your oral thrush. Ayan. Ano na ulit ang itsura ng Candida albicans? Yes? What does... Yes, this one. This one, guys. This one. This is your oral thrush. In my case, when I handled that client who had your laryngeal cancer, mas makapal, as in sa gitna. Like, merong snow ng candidiasis doon sa gitna ng tongue niya. Okay? So, your fluconazole is given because there is your presence of oral thrush. Okay? And your metronidazole is a standard antibiotic. Actually, what is the classification of your metronidazole? Miss Lakana, you call another person, please. Damay-damay na to. Yes. Yes. Mr. Cardona, bakit nandito na ba siya? Wala naman siya kanina. Absent naman siya. Mr. Cardona, are you here? So, bakit? Pwede bang mag-leave? Mag-leave sa klase kapag birthday mo? Kami nga, kapag pag nag-birthday kami, may pasok ka din. Mr. Cardona, are you here? Pasaway ka ha, hindi ka nagkwan. If you came in late, please note so that I could cross out your name here. Mr. Cardona, you're here. Mr. Carino, andito ka ba? Wala pa din. Mr. Corpus, are you here? Wala pa din. Mr. Santiago, wala. Okay. Mr. Cardona, yes. Birthday mo, sasagot ka pa rin, kahit birthday mo. Okay. What is the classification of your metronidazole? Miss Sobrepenya, yes. Noted. Yes? Hoy! Babalik kita sa pharmacology. Mali! Metronidazole is not a corticosteroid. May gulay ka. Any volunteers who would like to answer the question? What is the classification of metronidazole? May gulay. Your prednisone is a corticosteroid, but never your metronidazole. Remember, the suffix for corticosteroid, it's always your zone or one. Kasi nga, they are the number one anti-inflammatory. Please do not forget that one. You're going to be nurses in the clinical area. Diba? Gagraduate na kayo. Pagpunta nyo doon, hindi nyo alam yung mga gamot doon. Tapos sasabihin na, sino teacher nyo na pharmacology? Papaluin ko kayo eh. Wrong yan ha. Again, yes, any volunteer who would like to answer my question. What is the classification of metronidazole? Yes? Antibiotic. What particular antibiotic? What particular microorganism is it trying to kill? Yes, Miss Calpo? Ha? Yes. Yes, you're correct, Miss Calpo. Antiprotozoal. Correct. Sino yun? Mr. Kawis. Thank you very much. Antiprotozoal. Antiprotozoal antibiotic. Yan siya. Most of GI cases which is associated with your infection will always have orders in your client's chart for your metronidazole. Kung for example, meron kang surgical procedure and it is an abdominal GI procedure, hindi mawawala yung metronidazole dyan. If you have problems with gastritis, okay, and it is associated with a specific infection, hindi mawawala yung metronidazole. Anything that has something to do with your GI tract and there is your infectious process, hindi po nawawala ang metronidazole. And this is given via your IV bolus. Okay? It is in small, you have seen your dextrose, right? Big siya. Okay? So, you have seen 500 cc of your dextrose. Parang ganun lang yung size ng ating metronidazole in plastic bottles. And you give that to your patient. Metronidazole is an antiprotozoal medication. And amoeba. Guys, amoeba. Yan o. Amoeba. If you can remember your microbiology, sana may naalala pa kayo sa mga pinag-drawing ninyo na microbiology ninyo. An amoeba is a protozoal causative agent. Hence, your metronidazole is given to your client because there is your amoebic liver abscess. So, technically, your metronidazole is for this particular condition. Ayan o. Yan. Okay? those combination medication, your sulfamethoxazole and your trimethoprim, that's for your PCP. Your fluconazole is for your oral thrush, and your metronidazole is for your amoebic liver abscess. So these antibiotics, antiprotozoal, have already specific conditions which they are treating. This patient has 3 problems. Hindi, 4 yung problema ng pasyente natin kasi apart from HIV, meron din siyang infection, 3 infection. Diba? All of these guys are opportunistic infections. Gustong-gusto nila yung mga patients who are immunocompromised. Okay? Next, paracetamol 300 mg IV. This is obviously for the client who has your fever, 30. Kahit sabihin natin na, hindi low grade lang naman 37, 38, hindi pa yan masyadong mataas. It's actually your low grade fever. But paracetamol is given to this patient because there is really your hyperthermia. Okay. Next, your patient is placed on neutropenic precaution. What is neutropenic precaution? Guys, what is neutropenic precaution? Wala. What is neutropenic precaution? Yes. Sino yon? Who's raising the hand? What is neutropenic precaution? Yes? Who was that? Wala. Guys, alam niyo ba yung mga transmission-based precaution natin? Do you even know them? Actually, that is quite, not quite correct. The term isolation itself is not quite correct. There is such thing as isolation, and there is such thing as reverse isolation. Okay? Mukhang hindi nyo ata ma-identify yung ating transmission-based precaution para sa mga patients natin. Okay, you have to understand we have 3, actually, different types. Unang-una dyan, we have your universal precaution or your standard precaution. Okay? And then, yung transmission-based precautions natin, we have number 1, airborne precaution. We have number 2, droplet. Can you see, guys, what I'm writing? Nakikita nyo ba? Number 3, you have your contact precaution. Number 4, you have your bloodborne precaution. Number 5, you have your, neutropenic precaution. Nagets ninyo? From the term transmission-based precaution, your safety measures are dependent on how the disease is actually transmitted from one person to another. Hence, your goal here is to break that transmission of that disorder. You would not want any transmission to actually occur from one person to another. Airborne, mahabang usapan nito. Mamaya na lang siguro when we are going to go to your, when we go to your presentation. But, yung sinabi ni Mr. Castro na, isolation. Okay. Versus your reverse isolation. Okay. Ganito kasi yan. Ang understanding ni Mr. Castro, isolation, you need to isolate the patient and protect him from any person who might harbor an illness because he is immunocompromised. So, he places the patient in isolation. But, what's the difference between that type of isolation with the type of isolation that we also do for clients who have your SARS-CoV or your COVID? Diba, they are also placed on isolation. Diba? But they are not immunocompromised. They just are contagious. Nag-guess niyo the difference doon? You also place them in isolation. So actually, the term isolation is very much dependent, again, on the condition of your client. If you are going to be dealing with a patient who is contagious, then you use isolation measures. Your reason for placing that patient in a lone room, in a separate room, it's because that patient is contagious. As with our clients who have your COVID-19, or as with other clients who have your tuberculosis, they are contagious. Or a client who has your meningitis, meningococcemia, they are contagious. Okay? Ang nature ng condition ng patient na yon is they are contagious. Hence, you would like to protect everyone from that patient. Okay? You use the term isolation. But, if you're going to be handling a client who is immunocompromised, your reason for placing that patient in a lone room or in a separate room is that because you would like to protect him from the rest of the population. Because everyone will be considered as a vector of your infection. Even if you're healthy, you might be carrying something that can actually kill that patient because he or she is immunocompromised. Do you see the difference? Okay? Hence, if you're going to use the terms isolation, be very careful. Isolation, strictly isolation, word is for patients who are contagious. But for a client who is immunocompromised, you use the term reverse isolation. Bakit? Kasi nga, baliktad eh. Okay. How is it done? Transmission-based wise, yung airborne natin is your isolation. Airborne transmission-based precaution is called isolation. Kasi example of these conditions are TB, contagious, measles, contagious, chickenpox or varicella, contagious, COVID, contagious. Okay. So, if you are a nurse who will be handling that patient, you go to the client's room, you protect yourself because he is contagious. Understood? That's why we have our PPE, because that patient is contagious. You don't want to be contracting the disease and then go out of the room and sharing it to the rest of your clients. No, right? No, don't want that. So, isolation term applicable for airborne transmission-based precaution. Reverse isolation is applicable for neutropenic precaution. Why is it even called neutropenic? Kasi po, from the term neutropenia. Right? Neutrophils are actually part of your WBC segmenters. Correct? So when you say pinya or inya, it means to say there is a decrease in number. So hence, when we say neutropenia, there is a decrease or there is deficiency in the WBCs of that patient, likely requiring you to have extra protection for that time kasi immunocompromised siya. Okay? Now, why is it called reverse isolation? It's because the people who is going to come in does not necessarily need to wear this, full gear of protection. Kasi, sino ba ang contagious dito? Is it the patient or the visitors or the healthcare personnel? Yes? It's the visitors. Yes, they are infectious. So hence, who bears the burden of protecting himself? It's the patient. That's why when you go to clients who are in neutropenic precaution, okay, sino ba yung mga patients na mga immunocompromised? HIV patient. Patients who have cancer. Diba? If you go to oncology units, most of these patients, prior to pandemic, because everyone now wears masks, because everyone is considered immunocompromised, right? But prior to pandemic, when we go to oncology units, mga cancer rooms natin, most of them are immunocompromised because they have cancer. Okay? And cancer destroys all cells, correct? And that includes also your WBCs and lymphocytes and your leukocytes. Hence, they are immunocompromised. Now, if you go to their room, all of the patients, Okay? Kahit nag-chemotherapy ka or not chemotherapy, you are considered immunocompromised. You are considered a neutropenic type of patient. Hence, these patients, prior to the pandemic, wear your mask. If you go see, prior to pandemic, if you see people wearing masks before, you would know that they are immunocompromised. That's why they are protecting themselves. Kaya ang tawag natin dito, the correct term for neutropenic conditions or patients is reverse isolation. You would reverse the isolation because the patient will be isolating himself from the rest of the population because everyone is considered as an infectious individual. Okay? Hence, we call it neutropenic precaution. Okay? Kaya, again, if you go to burn unit, hindi ka naman kailangan mag-wear ng full gear PPE. No. It's a client who is going to be extra careful, extra protective measures in place. Okay? So I hope I have differentiated and distinguish your isolation versus reverse isolation, guys, ha? I'll be talking about your transmission-based precaution later on. Okay? But most definitely, I would just like to emphasize on these two. These are actually board exam questions. Isolation versus reverse isolation. Okay? Is it clear, everyone? Did you get it? Naintindihan ba? Clear? Okay. Any questions? Mr. Castro, nag-gets na yung difference ng dalawa? Okay. Balik tayo. Yan. I emphasize your neutropenic precaution. Apart from yung client protecting himself, we will be talking about later on specifics on your neutropenic precaution. Right? Later na lang pag mag-discuss na tayo ng presentation natin. Okay, and after that, we have your complete bed rest, that's the order of the doctor, oxygen via nasal cannula, 3 to 4 liters per minute, low fat, high caloric diet. Why does the client need low fat? Because po, anything that has something to do with the liver, okay, needs to have your low fat diet. Okay, your liver is responsible for the metabolism of your food. Or even your drugs for that matter. And since meron kang pus or abscess in the liver, the client's liver is not adept at metabolizing the fats. So in this case here, we should actually place the patient's liver on rest. So no fatty foods, no saturated fats, no to all of that one. So low fat, high caloric diet. Bakit high caloric diet? Because the client is losing weight. So you provide your high carbohydrate or high caloric diet for your client because of that weight loss in the span of 3 months. Okay? Antiretroviral medications were resumed with an additional medication of Norvir. So what were the antiretroviral medications that were resumed? Let's go back. Ito yon. Diba? He had history of 6 years HIV and he was on this antiretroviral therapy, yung Combivir and your Nelfinavir. So that's 1 and 2, pangalawa, and then another antiretroviral therapy or antiretroviral medication, which is your Norvir. Why do we need to give multiple antiretroviral drugs to this patient? You see, your HIV is very cunning. We need to have as much available medications, specifically your antiretroviral drugs, so that we could potentiate and maximize the effect of these antiretroviral drugs. Tandaan ninyo ha, viruses cannot be killed. We call it antiretroviral because we would like to slow down its effect. Remember, compared to your bacteria versus your virus, your drugs work effectively if you are going to combat your bacteria. Antibacteria, bactericidal, bacteriostat. Mabilis lang ang effect niya. But you see, the nature of the virus is that they are self-limiting. When we say self-limiting, yan. kusa po silang, it will just eventually go away. They are that strong. There is no such thing as it will kill your viruses unless you have your autoclave or your sterilization. But you cannot sterilize an HIV patient. Hindi pa yung autoclave ang patient natin, di ba? So, it will just weaken. Once the virus is weakened, that's the time that it can actually just eventually go away on its own. Kaya, for most viruses, okay, patients who have your diagnosis of viruses, it's very difficult to actually kill your viruses, or it's very difficult to eliminate your virus because they are self-limiting. They can only be defeated once they are weak. But as long as the patient's body is weak, ang mananalo dyan, it's the virus. That's why we have HIV for a long period of time. It's because as long as the virus is there, even if you have your antiretroviral therapy, but your immune system is not there to help combat your viruses, nothing will ever happen. Okay? So you need to have these 3 medications for this patient because you need to catch up with the lost time and lost effectivity of these medications for the 6 months that he has stopped taking the medicines. Hence, you have an additional Nervir. So, tatlo na po to potentiate and maximize the effect at such a short time, considering the fact that that patient is also suffering from tatlong infection. Did you get it? Okay? So, that's why we have these additional antiretroviral medications. Unfortunately, guys, this is for life. For this patient. You need to at least diminish the strength and we call it your virulence. Okay? Virulence, yung tapang ng virus natin. Matapang sila kasi nga, they could destroy your immune system because they change the genetic makeup of your existing soldiers, existing lymphocytes, the soldiers of your human body. Kaya ganyan sila. That's your viruses. Okay? Questions? May questions tayo? Let me continue. 2 days later, she is improved. Okay. Respiratory rate is down to 18 drops per minute. Auto-saturation is at 98 with an FiO2 of 21. Kasi, if you're going to have your FiO2, technically, more or less is going to be dependent also on your auto-saturation. FiO2, a fraction of inspired oxygen 21 is okay if you have auto-saturation of 98. FiO2 must be at 100% if your auto-saturation is actually decreased or desaturated to around 40s. Baliktaran siya. Okay? Your antibiotic, combined antibiotic, trimethoprim, sulfamethoxazole, ang hirap i-pronounce, is changed to oral. So, remember, initially it was given IV, and then now it's going to be oral. So, it means to say that the patient has established stability in his condition. By day 9, the patient's body temperature had normalized, and the WBC and CRP had decreased to normal values. By day 11, the patient was discharged and was told to continue his antiretroviral therapy and have follow-up consultation after a week. You see, the very reason why the patient was actually admitted in the hospital is because matigas po ang ulo niya. For 6 years, he has been taking your antiretroviral therapy. But because he had stopped his antiretroviral therapy and because the patient was not compliant with the medication regimen, he has suffered all of these things. Okay? Hence, later on in your task, we are going to do your telehealth consultation with patient MK. Okay? Naintindihan? So, that is for your case. Okay, information on your case. Do we have questions on the information on our case? Anyone? Clarification? Meron tayo? None? Okay, let's move on. These are your tasks. For the next 2 weeks that we're going to have our LP, okay, this is LP5, even if it's 6 rotation, LP5 po ito. Yan. We are going to have this particular task. Unang-una dyan, you will have your NCP based on 2 prioritized problems. Guys, Huwag naman kayo magbigay ng fever lang. Ang daming complication doon sa patient natin, ano. You try to prioritize. ABC ha, ABC. Prioritize your problems and make an NCP out of that one. Next, you're going to do your drug study of all the medications that is included in your learning packet. You already know the standard format for that one. Next, submit a journal analysis of any published article regarding the disease, HIV or PCP or complicated case of HIV, and talk about the diagnosis, talk about your management medical interventions. Please use the format which was given to you for your journal analysis. Remember, you need to attach the link of your specific article, and you just provide to me a very short summary, but you need to discuss what you learned from that particular article. You know that if I check your journal analysis, I check for plagiarism. Babasahin ko talaga yan, and you will not get any credit at all if you're just going to copy the article and then place it as if you are discussing it, not using your own words. There are guide questions for you to actually use in your template for journal analysis. Please utilize that one so that you would easily make your analysis and you could easily make your discussions using those guide questions. You need to relate it to local setting because most of these articles, they are westernized. Management diagnosis or updates is actually westernized, but you think about what's happening in the local setting and try to relate those updates with our local scenario, our local healthcare system, and how our local healthcare system is actually handling these problems or these particular conditions. Okay? And then last but not the least, we're going to do one-on-one telehealth consultation, discussing. I will be acting as your patient, Mr. MK, and you need to, as a nurse, kasi itong uso ngayon because of the pandemic, no, telehealth consultation is a very important avenue to provide education, health education to our clients. So what we're going to do, telehealth, para sa priority steps on what he must do to prevent further readmission with the same problem. Because again, I will like to reiterate, HIV is for life until you die. So hence, you need to follow a change in your lifestyle and you need to follow your medication regimen. You will need to emphasize on his compliance in his antiretroviral therapy to reduce viral load and slowing disease progression. There is no cure for HIV, guys. Walang cure po. Most of the patients that I've handled who have HIV, namamatay sila. They die. It's not because of the disease. They die because of the opportunistic infection. So if you are diagnosed to have your HIV, you need to protect yourself from this opportunistic infection, or else you are actually half of your body is actually 6 feet under already if you are diagnosed to have HIV. Immunocompromised ka, wala kang magagawa dyan. So what you need to do is to protect yourself. Again, many patients die not because of HIV. Many patients die because they have acquired or contracted infection. And eventually, because their immune system is not strong enough to combat these opportunistic infections, they die. Imagine dying because nagkaroon ka ng pneumonia. But for a healthy individual, pneumonia can easily be treated because you have your antibiotics, right? Because that healthy individual has a working immune system. Pero that's not the case when you have your HIV. It's never the case for HIV patients and then opportunistic infection. It's a more complicated case. Naintindihan? So I'll be asking questions regarding my antiretroviral. I'll be taking the role of Mr. MK. So please prepare your your script. You can have your script for that. But I'll be asking questions, anything related to my therapeutic regimen and anything that's related to the condition that I am in. Okay? So please prepare your health information or health education for me as patient MK. Okay. The schedule for we might be starting on May 7 for your one-on-one telehealth consultation. Mauna mo na yung King ha. we follow what is written, what is in your schedule. So, let's start with, let me share, sandali. Yan. For the first people who will have your one-on-one telehealth consultation, group 13 muna, King. And then, included doon yung Lininger. That's for, I hope you could finish. Siguro 10 minutes lang naman. 10 minutes for each person. For our telehealth consultation. Let's start on May 7. May 7. We have 3 days for your synchronous session until May 13. Okay, because May 5 and 6, it's for your synchronous, and the rest would be asynchronous session. Okay, so group 13 start on May 7. We have the whole day for that one. Group 15, next week na kayo. Sana matapos natin. Okay? Questions, guys? Any questions? I hope our task is actually clear. Questions po sa mga tasks natin? None? Is it clear, everyone? Okay. Yan ang ating, ayan, you will be greeted. Yes, Miss Favor. Mm-hmm. 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 Discussion, it means to say that's your analysis. That's your understanding of the article. There are guide questions that were indicated in your template. So you need to relate whatever is written in your article and try to relate it, try to answer the questions, the given questions in your template. Okay, like for example, No, those are guide questions only, right? Guide questions. Now, if you can provide more in-depth analysis, because this is analysis, the guide questions are there to help you actually phrase your sentences well. Okay, so, and also to provide you, a guide on how you might be able to analyze your article. So, technically, do not just limit yourself into answering those guide questions. You could also place inputs, what you understand with the article. I'd like to see your own words on the discussion. That's why it's called discussion, because you're also going to analyze how the article or how the updates could actually be of help in our nursing practice. That's why we have your journal analysis. Okay, so you do not again limit yourself in just answering the question, pros and cons, how is it advantageous for local scenario. No, those are just guide questions. If you have more inputs, you place them there. But please do not copy and paste, because I will know. I have a particular application to use to check if you are just copying and pasting, and that's plagiarism. I will not appreciate that, and I will not give credit to that one. Just place your hyperlink. I do not need the whole article. I need to have the link of that article. And when I click on that link, it has to provide to me all. Dapat nakita ko, I should read all about that article. If you're going to give me a link which is a published journal tapos nakat siya, I will not accept that one. Okay? I should read all of the article. So if I visit that website or that page, I should read all of the article. So you hyperlink the URL of that article, place that in your journal, and then give me just a short summary of that journal, okay, article, and then give me a more comprehensive discussion. If your summary is longer than the discussion, then that is not your journal analysis. That's copy-pasting of your article. Okay? I should see more discussion. I should see more critical thinking, discussion, and analysis for your article. Okay? For your journal. Okay? Did I make myself clear, everyone? Did I answer your question, Miss Favor? Okay. How about the rest? Matinong usapan ha. Babasahin ko yan isa-isa. Kahit madami kayo, kahit 40 kayo, babasahin ko yan isa-isa. And I will know if you just copy-pasted. Yes, questions. Who's raising hand? Yes. Yes. Hindi pa ako not today, obviously not today. You could give it next week. I'll be specifying dates pagkatapos ng synchronous session natin. Okay, but definitely not today. Next week na siya. Okay? Miss Bukasas? Gusto mo ba ngayon? Pwede naman. Oo. Okay. Yes, any more questions, guys? Questions? Yes. Hindi na. Hindi na. Just your check mark. Yes naman. Yes, you can. Yes, okay. Just prepare your script, Prepare your script. And I'll be asking questions. Again, I'll be asking questions not only related to your antiretroviral therapy, but also about my condition. So you have to really read up on your case and also read up on education materials regarding HIV. Okay? Questions? Any more questions? Yes, Miss Fever, you're trying to raise your hand earlier. No more. Okay. If there are no more questions, that ends our learning packet orientation. Haba, no? Sorry guys ha, nag-discuss na rin ako at the same time. We still have 1 more hour before our synchronous session ends. Let me go to our discussion, PowerPoint presentation for a while. Dali lang ha. Can you see this one? See na? Okay. This is HIV/AIDS with complication. You always, whenever you hear the word HIV, okay, usually it's, parang twinning with your AIDS, right? There's difference between HIV and that of AIDS. HIV, when you have HIV positive, ibig sabihin nun, you have the virus circulating in your system. But when you have your AIDS, it means to say, it's the more complicated scenario of an HIV positive patient. Once you have a CD4 count of less than 200, then you could be a person who has your AIDS already because there is your immunodeficiency already. Okay, there's a difference between your HIV and your AIDS. Okay, if you're going to think about AIDS, complicated siya. Ito yung mas malapit ng madedok. Mas maraming problems ang AIDS patient natin. It's because you have your there's already, you're technically and literally speaking, your client is already immunocompromised. Okay? So, let's move on. Yan. Having an STD, we always associate HIV when we have your STD or sexually transmitted disease. But it is a fact that having an STD, an existing STD, you know the different STDs, chlamydia, gonorrhea, syphilis, lahat-lahat ng mga yan. If you have an existing STD, it also increases your chance, diba? The more, the merrier. Increases your chance of getting your HIV. It's because ang transmission niya is because of your body fluids. Body fluids, Okay? So, let's talk about your HIV first. This virus is 400,000 times smaller than a golf ball and a nasty killer. 43 million people are estimated to be living with HIV, and this, I think, is a statistics which is actually increased until these days. Okay? Ang HIV kasi, I think it was identified in the early 80s. Mga 1980s, early 80s pa lang ha. So, imagine mo, ilang years pa lang siya in existence. Ayun, siguro matagal na siya, but technically identified by CDC as a contagious disorder. And worldwide, a worldwide pandemic. It is a pandemic because a lot of people have your HIV. And when we talk about, no, actually, it's not even talked about in normal conversations because it's like a taboo, especially in the Philippines. And you know that the Philippines has the highest number of HIV cases, increasing number of HIV cases in all of Asia and in all of the world. Sobrang dami. Well, the rest of the world's cases are actually going down. Sa Philippines, sobrang taas. Sobrang taas po. And the question is, bakit? Paano nangyari yun? We'll be talking about that one later. Okay. Human immunodeficiency virus. It kills cells which help the body. Technically, this is your CD4 or your helper T cells, which is very much affected by your HIV. No effective cure, guys. No matter how many years of study has been done by most scientists, by most health professionals, mga microbiologists, health experts, wala pa rin pong cure ang HIV. There has been no effective cure for HIV. But, it's a good thing that it can be controlled. Ibig sabihin nun, as long as you keep your HIV virus weak, then you can actually extend your life. As long as you make them weak, hence your antiretroviral therapy. You can have proper medical care, you can extend your life. As long as you be following your protocol and following your medication regimen. No? It is caused by your HIV/AIDS caused by HIV. There are two strains. You have your HIV-1 and you have your HIV-2. HIV-1 is more virulent. Ibig sabihin, mas matapang po siya. It's actually the one that's existing in the United States. HIV. And HIV-2 exists along with HIV-1. Doble-doble yung sa kanila. And this is very much found in most African countries. In the past years, there have been many documentaries about a lot of African communities who are afflicted with your HIV. I don't know if it has something to do with their culture or because of yung existing na HIV cases doon, tapos hindi nabigyan ng proper safety protocols. Because once there is an outbreak of HIV, and then you did not do your infection control measures, it will spread like wildfire all over the place. And I think that's what happened in Africa. That's why even your kids, babies, have your HIV. It's because I think in the past, healthcare system there was actually not too good. That's why there are so many foreign and international organizations who help these African communities to control the transmission of your HIV. Kasi nga, pandemic ito sa kanila in their country. In the United States, well, I think it has something to do with the lifestyle. Lifestyle of most people who are promiscuous. Alam niyo naman, no? Gay rights. This is not to malign or discriminate yung third sex, ha? But you see, statistics-wise, it's very prevalent among the homosexuals. And I think because before, their sexual practices they have not been informed of the repercussions of unsafe sex and unprotected sex because they have different sexual practices compared to men and women. But you have to understand, it's not just only among the homosexuals which HIV are found. It's actually going to be affecting all gender. All gender po yan. It's just that according to statistics, it's very much prevalent among the homosexuals. Yan. Kaya nga, di ba si patient natin, patient MK, ano bang social characteristic niya or profiling niya? Gay professional. Okay, gay professional. So, next, let's move on.